Thank you for clicking on the HMC web link and for your interest in this topic. The presentation will be delivered by John McHugh, who serves as the Chief Pharmacy Officer for HMC HealthWorks. He is responsible for the proactive medical and pharmacological management efficiencies and integrity of clinical operations with HMC's initiatives. As a licensed pharmacist with an MBA, he has in-depth experience in various disciplines of pharmaceutical care and risk management. His clinical expertise, combined with an understanding of business operations, brings a balance of fiscal and pharmaceutical insight for healthcare management. The presentation will now begin.
Thank you so much for your interest in this national crisis that exists today in the United States. This presentation on the opioid crisis covers opioid facts and figures that demonstrate the severity of the existing crisis in America today. Opioid use disorder does not discriminate. It touches all socioeconomic classes, genders, ethnicity. The human body does not discriminate. It reacts to both legal and illegal opiates, with addiction potential equal for both. We're in the grip of an opioid crisis characterized by addiction and death such as we have never seen. Too often, this is affecting our young people. The consequences of untreated mental illness and addiction have been tragic, frequently associated with violence and death. As you'll see in some of the slides, newborns to young adults are impacted by this terrible disease and this terrible chronic disease. So let's start and just take a look at some of the figures around the opioid epidemic we have today. The United States represents less than 6% of the global population, but we consume 80% of the world's supply of opioids. The U.S. consumption of opioid drugs per capita is 5.4%, and that was in 2013. This is the highest of any country in the world, and our death rate per million due to opioid overdoses falls right in line with those rankings. Additionally, according to the National Institutes of Drug Abuse, the number of prescriptions for opiates like hydrocodone and oxycodone have escalated from around 76 million in 1991 to nearly 207 million in 2013. With the United States, their biggest consumer globally, the pharmaceutical companies and the opioids are accounting for almost 100% of the world's total consumption. The hydrocodone almost at 100%. Oxycodone at 81%. The amount of oxycodone and the amount of hydrocodone that are in the average prescriptions are phenomenal. That is one of the challenges that we have today, and that is what this excess of opioids in the home leads to in the future of additional people becoming addicted to opioids. So let's look at where do the RX abusers or those people with opioid use disorder get the medication to start. And let's just think about this. The young Americans today are the ones from 14 to 21. They are at the highest risk because they seem to feel 50% of them do not see anything wrong with trying an opioid a couple of times. Almost 45% don't think there's a problem trying heroin once or twice. They are the most susceptible ones to be caught in this grip of opioid use disorder, going down a road of addiction where everything else has no merit and it's all about the medication and it's about the fix. So 70% of the abusers got the drugs from their friends or family. Parents go out. Opioids are not locked. They're usually in the medicine cabinet, in the bathroom, it might be in the bedroom. They have access, and that's how they start. 60% of the Americans that have prescription opioids have some left over, because when we get into the prescribing and dispensing, there were greater quantities and greater doses given before many of the strategies today to reduce that happened in the states and the nation in the outcry. The CDC then decided to focus more on a better way to manage opioid prescribing and dispensing. So what about the abusers and those that suffer from opioid use disorder? The biggest collateral damage is on our nation's children. 86% increase in calls for the poison control centers with pediatric exposure from 2000 to 2009. 86% increase, almost doubled. This is happening to our children. That 60% of the accidental exposure in kids under the age of 5, these are the babies. When we talk about prenatal situations, over 500% increase from 2000 to 2012 in the neonatal abstinence syndrome. Every 25 minutes, a baby is born suffering from opioid withdrawal. This is a tragedy that we have to amend. So what have we learned, and what has the CDC put out regarding the management and the proper prescribing for these medications? Well, if you look on the next slide here, opioid dependence can start in just a few days. The longer you're on it, the higher the possibility of becoming addiction. Probably 50% of those people that become addicted have an addictive gene that is in their body that leads to that. 30% of the patients who first use an opioid more than 30 days will remain on it in therapy after 1 year. Once it's beyond 30 days, there's a higher prevalence of addiction or opioid use disorder. And then, of course, 80% of all those who use illicit drugs, the street drugs, started out with prescription opioids, probably because they were easily obtainable. So minimizing early exposure can make the most immediate and substantial impact. And so PBMs today and the CDC capitalized on limiting the day's supply, the quantity of prescriptions, and started to put some clinical utilization management strategies in place that is helping to reduce the quantity and the doses of prescriptions that are being given out today. They are in alignment with the CDC. They said in their guidelines that opioids are not supposed to be the primary use for pain and the first use for pain. Non-opioid alternatives are to be used. So we realize the CDC guidelines are helping to promote the safe and effective use. We realize also that some of the states have taken further action to reduce the day's supply of opioids that can be given. Florida just recently reduced their day supply to 3 for those patients taking it for short-term injury. New York, New Jersey, some of the Northeast states have quantity limits and days limits of up to 7 days. That will help to reduce new people possibly becoming addicted through an educational session, an educational ability by the CDC and the states, as well as with national support. So one of the things that we did find, as we mentioned, there are some genetic traits that lead to a higher prevalence of opioid use disorder, but also those that are addicted to heroin, we're able to find out that it was not just one drug that brought them down the path of heroin use, that the other incidents of addiction, whether to alcohol, marijuana, cocaine, and with the most prevalence, the prescription opioid medications, those that are on those medications have a 40 times greater possibility of becoming addicted to the street drug heroin. So once we have identified, if you look on the next slide, once we've identified those patients on opioid use disorder and they want to go into the process of detoxing and being in control of this chronic condition, we found that medication-assisted treatment which is the use of medications with counseling and behavioral therapies to treat substance use disorders or opioid use disorder, that 72% of these patients did not have any indication of medication-assisted therapy after a dependence or previous overdose. And we also found out patients who overdosed received an opiate prescription within 10 months after that. So even the fear of death and the possibility of experiencing an overdose and having to be revived with naloxone does not make a difference without this medication-assisted therapy. There is a higher prevalence for control and cure over this chronic disease over time. The 40 to 60% average relapse rate is occurring because it is a chronic condition, and medication must be used to control the urges and to be able to manage those patients that are on the opioids. So let's look at how does this impact the facts and figures. Let's look at the economic of opioid abusers versus non-abusers. The dollars that are spent in medical costs and usually paid by an insurance provider or carrier, $15,000 excess, the non-abusers. And more importantly, productivity drops dramatically, 50% or more missed work days, abusers versus non-abusers. And you have to realize that after a certain amount of time, the patient who is addicted cannot work because their total focus is on the obtaining of the medication. And that's all that matters at this point. So some of the other figures talking about economics and the dollars that are being spent today. Economic impact, $1 trillion from 2001 to 17. They're projecting an additional $500 billion by 2020. Even with the protocols that are in place with the CDC, some of the management techniques by the states, there's still a high risk because this is such a terrible and chronic disease. $78 billion a year in ER and inpatient care for opioid poisonings. That's not taking into consideration those that are happening on the streets with the first responders. An average day in the US, over 588,000 opioid prescriptions are dispensed. Now, yes, in the coming years, we should see that start to drop. The number of prescriptions should drop, but more importantly, the dosages and the quantities of prescription will start to drop. Just under 4,000 people begin non-medical use of prescription opioids. Using prescription opioids, the painkillers, for something other than medical pain, to numb the senses. So there are 580 people every day that begin the heroin use. And that we can see will most likely start to increase as we start to limit those medications that are on the street today. The prescription opioids, as a result of some of our actions, will start to decrease prescription opioid availability, which leads people only to be able to go to the illicit opioids. So let's look at the drug overdose death data. We're talking now both prescriptions and illicit use, 42,000 deaths in 2016. ER visits, 30% from 2016 to 17. 115 Americans die every day from opioid overdose. The prescription opioids everybody's familiar with is the OxyContin, the Vicodin, the Percocets, methadone, fentanyl, long-acting, which is very, very toxic. Illicit opioids, the heroin and the carfentanil, 100 times more potent than fentanyl, and fentanyl is 50 to 100 times more potent than morphine. If you look at that penny, that's the lethal dose of fentanyl. It's a couple of grains of sugar or salt. That's how little can kill an American adult. it is right now the most prevalent reason that those that are on street drugs, specifically the heroin, that is cut or added to the medication, to the heroin. You've also got it laced with some street marijuana. There are severe issues where majority of younger populations can be devastated with this medication added to some of the street drugs. So if we look at the 2016 state statistics, West Virginia's in the lead with over 43 per 100,000. New Hampshire's next, Ohio and Maryland. If you look at the significant increases in overdose death rates, it's across 50% of the states have had significant increases. Clearly, we have a situation today where action must be taken. We have to reduce the stigma of those people that have opioid use disorder. We have to look at medication-assisted therapies in combination with counseling and psychiatric care to find the underlying causes that initiated the opioid use disorder, the numbing of the body to other things, the biochemical processes that happen in the brain to cause this addiction, the dopamine release, and all the neurotransmitters that cause this take away the free will for the person suffering from this chronic disease. We must continue to look ahead in controlling and managing. If you look at the increased death rates 2015 to 20 on opioid prescriptions per person on the next slide, the highest prevalence is in the Northeast. We have Florida and Texas, and then up in Minnesota, Wisconsin. The CDC has been tracking and watching, and we have to be aware of the crisis that exists today. So please, if you have any of the opioids left in your home, no matter where it is, put it somewhere safely under lock and key. Please try and use non-opioids whenever possible for pain relief, and resort only to them in the severest of conditions for a short term. Thank you very much for your interest, and have a great day.